Welcome everyone to Changemakers Chats, brought to you by Breast Cancer Prevention Partners. I'm Amanda Heyer, CEO of Breast Cancer Prevention Partners, and I am so excited to be with all of you today and welcome two extraordinary guests to our series. This is the second episode of our new virtual interview series that we are offering to you all to bring you a direct way to connect with and be in discussion with leading public health and environmental health experts during this time of great uncertainty. So the series will be ongoing and have an emphasis on COVID-19 as well as social justice issues and how these crises connect to the work that BCPP and our partners are advancing. So today I am so incredibly excited to welcome the following speakers to our discussion. We have joining us today Dr. Linda Birnbaum, Emeritus Director, National Institute of Environmental Health Sciences, NIEHS, and the National Toxicology Program. Welcome, Linda. Thank you for joining us. We also have Dr. Meredith Williams, Director of the California Department of Toxic Substances Control. So just a few quick notes before we kick things off and dive into our lively discussion. Our Changemakers Chats are free, and like all nonprofits, we depend on the support from folks like you all, the generous support of all of our supporters. So we hope that you will continue to consider making a gift today. For those of you that have already supported today, thank you so much. So your support allows us to sustain our crucial work during these times. So we'll be providing a link to donate in the chat, or you can simply go online at bcpp.org and make a gift. So all participants will be muted throughout the duration of our program today, but please use, you can use the chat function for any technical issues or any general questions. And then if you have specific questions, we're going to have ample time at the end for a very robust Q&A. So please use the Q&A function, and I will do my best to get to as many of your questions as possible. So also one last note, we'll be providing this recording post-event in case you'd like to rewatch it or share it with your friends and family and your network. So Meredith and Linda, your work represents two critical yet different approaches to better understanding and regulating the presence of toxic chemicals in our lives, both of which are critical to the work of BCPP. Linda, your work has been focused on the foundational scientific research that underlies everything that BCPP does, while Meredith, you've been working on the policy side to put that research into work, overseeing one of the country's most comprehensive state programs designed to ensure the safety of chemicals in consumer products. We are so honored to have you both here today. So Linda, you recently retired. I'll start with you. So you recently retired from a 40-year career as a federal scientist, spending almost 2 decades at the Environmental Protection Agency, and most recently directing the National Institute of Environmental Health and Sciences, as well as the National Toxicology Program. NIEHS has come a long way in the last 50 years, making environmental health research responsive to the needs and the concerns of the American people, and really making the environment part of the public health debate. So looking back at your career, what were some of the highlights and challenges of serving under 7 different administrations?
Well, I think it's important to note that my first 10 years were also at NIEHS, where I started as a tenure-track scientist and did get tenure, moved up the ladder. I have to say, when I first went to NIEHS, I didn't even know what toxicology was. I had to look it up. At that point, of course, it was in a book. I couldn't just go to Wikipedia or something. And so my first 10 years were really a learning experience where I became really immersed and got very involved with concerns for environmental chemicals. And then the next almost 20 that I spent at EPA, for most of them, I ran the largest health research division. And again, for me, what's always great is when you're learning new things. And so when I started working with that division, I really knew next to nothing about immunotoxicity. I knew very little about air pollution or pulmonary effects. And those were 2 of the major areas that I ended up being responsible for, as well as continuing the work that I'd started at NIEHS, dealing with dioxins and PCBs and other persistent compounds. All the time that I was, were pretty much right from the beginning, I was able to be adjunct faculty at both University of North Carolina, Chapel Hill, and at Duke, and that was great because that enabled me to have graduate students and postdocs in my lab and have some of that academic kind of experience as well. My last year and a half or 2 years at EPA were really very foundational for me because I actually kind of got my feet wet in the more regulatory environment where I headed up a cross EPA effort to deal with the asbestos pollution in Libby, Montana. Libby is the only Superfund site in the nation where we actually have dead bodies from the asbestos, which contaminated the vermiculite that was mined just outside the town limits. And in that effort, I was kind of providing leadership of the research efforts, both epidemiological studies and toxicological and mechanistic studies, but I was also coordinating what was going on in the Superfund office in Washington, and then what was going on with boots on the ground in Region 8 in Denver. And so that was really a truly learning experience. I guess the other really major learning thing I did
Thank you. Whoops. Thank you so much for.
Should I continue, Amanda?
Yes, please do. I think we just had a little interruption.
Okay.
Please go.
So one of the major things that was exciting for me, as I said, when I started at NIEHS, that's when I started learning about toxicology. After I'd been at EPA about 12 years, I had the opportunity to run their health effects division, which did not only actual clinical studies where people were intentionally exposed to certain kinds of air pollution in chambers or possibly certain other contaminants to look at other kinds of pathways of exposure usually, but also that was the group that did the epidemiology in that research group. And so it kind of immersed me in the human health aspects of things, not just the mechanistic and the animal side of things. So that was really, really helpful for me to learn. And then when I then was recruited back to run NIEHS, I really had a better idea of the totality of what NIEHS does. And NIEHS is the largest funder and probably conductor of both basic biomedical research in environmental health, but also a lot of epidemiological observations. Anyway, I think that's enough to give you an idea, and I'm happy to answer any other questions or respond later.
Thank you, Linda. And we'll be touching on the human aspect of your work a little bit later when we talk about our current environment in terms of social justice issues. So okay. I'm going to move to Meredith. So Meredith, speaking of changes, while Linda has just retired, you were recently appointed by Governor Gavin Newsom to head up the California Department of Toxic Substances Control after having served as the director of the agency's Safer Consumer Products Program. So tell us a little bit about what DTSC does, and also why is the Safer Consumer Products Program considered so unique?
Thank you. Well, happy to share a little about that. But before I dive into our work, I do want to say it's just great to be on a panel with Linda. And I wanted to tell a little story about Linda. It's a very little story, but it just says so much about her, which is we were both at the American Home Furnishings Association once to speak to them about our respective work. And over the lunch meeting, we were listening to a number of manufacturers express concern about how they were going to control formaldehyde and what a problem it was. But they were coming at it with that, the regulation is a problem. And finally, it fell on Linda to just stand up and remind them that it's a carcinogen. Very simple, just oh, by the way. And it was really something to watch. So I wanted to tell that little story before we got started. And DTSC definitely relies on the work of NIEHS, both biomonitoring work, the National Toxicology Program, list is one of the authoritative lists that we reference in Safer Consumer Products. So we're very dependent on that work. What the department does is, I like to talk about it in terms of past, present, and future. We're really responsible for cleaning up the legacy of toxic contamination from the past. That's our site mitigation and remediation program. When we talk about the present, we're trying to make sure that, sorry, motion detection. We're trying to make sure that the hazardous materials that are used now in commerce and are transported around the state and disposed of are done so properly and handled correctly with our hazardous waste management laws. And then, of course, the Safer Consumer Products program that you mentioned, which really is a lot about the future, really about shifting that paradigm for how we think about toxic chemicals, how we regulate them, and how we avoid the problems in the first place. And what's unique about that program is really, first of all, just the regulatory standard. It is a very precautionary program. You know, it's good to be on our breast cancer prevention partners, because I think that's the way we all need to start thinking. And that precautionary preventive construct is right in the regulations. So there are two parts to it. One is, what product chemical combinations do we care about? Which ones are we going to tackle? And that's based on a regulatory standard, which is just, is the chemical actually in the product, and is there a potential for exposure? And then, could that exposure contribute to or cause significant or widespread adverse impact? And as regulatory standards go, that's a pretty relatively low bar, which is great in terms of being able to take action. And then after we go through the reg process, and I will not walk everybody through the 4 steps of the process, eventually it falls on the manufacturer to look for a safer alternative. And again, we ask them to do it in a very different way. It's a very comprehensive alternatives analysis that's really intended to avoid those unintended consequences. It's very science-based. When we list those priority products, those product chemical combinations, it's not a traditional risk assessment. It's really about doing a thorough analysis of the potential for the exposure. We rely on the state's peer review process. But it does, because of that low threshold, it does allow us to take advantage of emerging science more quickly than a lot of other regulatory frameworks, and that's really advantageous. And again, when the manufacturers do that alternatives analysis, the whole point is to avoid those unintended consequences, those regrettable substitutes, the BPA, BPS, everybody knows those merry-go-rounds of chemicals. So, you know, in summary, it's really a paradigm shift. Again, putting the burden on the manufacturers to say that something is actually safe. It's a very public process. There are lots of insertion points where all sorts of folks can just comment on our work, add additional scientific information if we've missed it, tell us what they think the priorities of the program should be. And ultimately, it's about driving towards this green chemistry-based economy and different approaches.
We are so grateful that you were part of that great paradigm shift. That is how we work at BCPP. It's based on what you were contributing, so thank you. So now I'm actually going to shift our conversation to endocrine and hormone disrupting chemicals, breast cancer, and COVID-19. So BCPP has long been concerned about the link between endocrine disrupting compounds, EDCs, and an increased risk of breast cancer. So we spent over a decade fighting for state and federal legislation to more strictly regulate BPA, considered the poster child for hormonally active chemicals, and things like food packaging as well as other products. And more science is showing a relationship between the chemicals that we have been fighting to have regulated for so many years and an increased risk of COVID-19. So Linda, you recently published an article about the connection between exposure to endocrine disrupting compounds and an increase in COVID-19 susceptibility. So please, if you can, highlight some of your key findings for us.
Well, this was really just a, you know, it was not a new, it was a new way of looking at things. But I think the important thing is that endocrine disrupting chemicals impact many of the major risk factors for COVID-19. So what are the risk factors for this virus? obviously, age is not something that we have any control of. It happens, obviously, like gray hair. But think about things like obesity, diabetes, heart disease, cancer, asthma, just to use those as an example. All those things put people at greater risk. And many endocrine disrupting chemicals, we now know, play a role in all of those things. So there's lots of studies now showing, for example, that BPA exposure is associated with an increased risk of obesity and type 2 diabetes. There's lots of data showing, say, phthalate exposure is associated with an increased risk of asthma. There's lots of data showing that, and now maybe people don't often think about arsenic as an endocrine disruptor, but arsenic is very much an endocrine disruptor, clearly associated with increased risk of cardiovascular disease. And the thing I don't think, and lung disease, obviously many of these things are associated with increased risk of lung disease. Certainly air pollution, which has many endocrine disrupting chemicals in it, such as all the PAHs, clearly associated cardiovascular disease, pulmonary disease, obesity, diabetes, asthma. Now, in addition, I didn't mention the immune system. And there is more and more evidence that exposure to a number of different endocrine disrupting chemicals, whether we go back to our good old friends, the dioxins and the PCBs, or whether we look at some of our newer friends like PFAS, and obviously I'm being a little sarcastic here when I talk about our friends, but all of those chemicals suppress the primary immune response. So what does that mean? That means that you have more difficulty mounting a response to a viral challenge, and I should say, maybe more difficulty getting a therapeutic response if you're vaccinated against something. So I think that there's this intersection between many, many different endocrine disrupting chemicals and many different health endpoints, which put us more at risk for the virus.
Thank you. So Meredith, I know I'd love actually to know more about how COVID-19 has impacted the work of DTSC. So the EPA has used the pandemic as an excuse to stop enforcing environmental protection laws, specifically related to monitoring and reporting pollution. So I'm curious, from your perspective, do you think California can fill the gaps created by the US EPA abdicating its responsibility for protecting the public from these hazardous air pollutants that have been known and shown to exacerbate the impacts of the coronavirus? And, just in general, if you could tell us, how has DTSC responded?
Well, I'll start with the second part of the question first, which is how have we responded? I think it's good news, bad news. I think we've been able to get our staff situated to work remotely. We've been very fortunate, we were not at all configured for that. And we now, our more than 900 staff are able to do the vast majority of the work at home. What really starts to happen though is you start to get in the bad news, which is if you're really going to have effective environmental protection, you got to be outside, you got to be out in the field. And whether that's cleaning up and remediating contamination or doing inspections to make sure that permits that we write are being properly implemented, it really means you got to be out there and in the field. And this is especially the time of year where our field work normally has geared up, and we're very far behind in that. We are doing cleanup work out in the field, but it's greatly reduced, and that is a concern. And then obviously you ask about the federal gap. I do want to say there are some differences with California. We actually don't even have the authority to suspend hazardous waste control laws. And so that's off the table. We have a pretty big, pretty healthy program to offer regulatory assistance to businesses. And those folks, you can imagine, have been very, very busy fielding calls about how to keep people in compliance and how to help them if they're accumulating hazardous waste and they don't have the means to dispose of it. They can request extensions to storing it on site, but they have to do it properly. We have to make sure things are done safely. So we did not suspend any of our work in wholesale the way the feds did. And yet you have to do the inspections in order to properly enforce. Can we fill that gap? With respect to the federal government, I think that's a lot to ask, especially with the federal government that, for instance, has often had California in its line of fire in terms of what California normally does, which is raise the bar in terms of environmental protection. And so it makes it hard to keep things going, and it takes resources just to deal with a lot of that. It's a big hole to fill, and we're doing our best, but it's a lot to take on.
Can I say something? Amanda, I just want to thank Meredith and the whole state of California, because if it weren't for California, I'm not sure where we'd be with many of our environmental laws and different kinds of protection. So thanks, Meredith, for the state.
Well, I will say, you know, we're proud to be in California, and we feel that it's almost like pressure. Because people do have the expectations when when you stop seeing action at the federal level, it really makes us feel especially responsible to keep things moving. But it's hard, given the budget problems that are happening as a result of COVID. It's going to get even harder.
Truly. Okay, so now I'd like us to connect the dots between environmental health and environmental justice. So clearly we are living in profound times where racial injustices simply can no longer be denied in any way, shape, or form, thankfully. And, you know, clearly both of you as leaders in public health and environmental health have made environmental justice issues a primary part of your career and your focus. The work of your departments have done so too, thanks to your leadership. And so I'll start with you, Linda. So NIEHS has had a long history of working on environmental justice issues. So in terms of both generating science to better understand why certain communities are more at risk of environmental exposures, and then conducting participatory research studies to involve those communities that are most at risk. So I'd love to hear from you why environmental justice issues have been so interwoven with the environmental health science your agency is so known for.
Well, thank you, Amanda. I think there are a couple reasons. One is that I don't think you can do environmental health work without becoming involved with the communities. The communities are the people, I mean, it's not only the boots meeting the ground there, but that's where they know what their problem is. You have to get out and go with the communities. I really have to acknowledge Dr. Ken Olden, who was not my immediate predecessor, but two ago, who really got very involved and provided leadership, I think leadership across many parts of the federal government about the need to look at issues of disadvantaged communities and minority communities. And the point is that those communities are often more highly exposed for multiple reasons than our more advantaged communities. That's not, you know, there are many reasons for it, but, you know, one thing that I did is every year I did several community visits where I would, in different parts of the country, where there were real issues of what I would say in some ways is environmental racism and environmental injustice. And listening to members of the community raise issues, talk about their questions is very empowering, and actually then fed back to some of the research programs that we initiated. But, you know, again, we have this program, I'm still emeritus, so I still have some associations. We have the Partnerships in Environmental Public Health, which is an umbrella kind of administrative management way to link all the different community engagement programs that we had. I mean, one of the first things I did when I came in is I said, every one of our centers programs must have a community engagement core. They often used to be called community outreach and engagement, and I wanted to take out the outreach because that sounds like a helicopter coming in, you know, and then going out. We needed to be involved in every aspect from the get-go. And so starting with the president's, the executive order under President Clinton in 1994 related to environmental justice, NIEHS has, I think, played a leadership role in this area.
It's incredible. and I'm certain not met without some significant resistance at times. So thank you so much for persevering.
Very honestly, I was not allowed to use the words environmental justice in my slides in 17, 18, or 19.
Unbelievable.
Yeah.
All right, so Meredith, in the state the size of California, where people of color are nearing the majority of the population and yet still struggle because of systemic racism and the related social and economic inequities that are leading to some significant health disparities, I'm curious, what is DTSC doing to strengthen its relationship with and response to the California communities that are really carrying the biggest burden in terms of chemical exposures that are linked to increased risk of breast cancer, as well as a myriad of other diseases?
Well, I'm sure a number of people who are on the call today are aware of the CalEnviroScreen tool, which is a tool that really maps where the environmental justice communities are in California. And that tool really tells a story about the pollution burden in these communities. And as I was preparing for this talk, I really wanted to see the correlation between the CalEnviroScreen score and the incidence of COVID. And I may actually go back and ask if somebody could do that correlation, or at least develop a map with that overlay if they haven't already done so. But it really tells a story about the multiple burdens, the transportation, air pollution, the siting of facilities, the truck traffic, you name it. And obviously, we're really starting to see what that means and what that translates into in terms of a disease like this and the pandemic. The department, DTSC, has a strong environmental justice program in our Office of Environmental Equity. And even within that program and across the department, we've developed strategies around environmental justice, and they would echo a lot of the things that Linda just talked about, which is how do you actually create partnerships with the communities? How do you learn from them, take information in, and make sure it's really informing your decisions in a productive way? And how do you embed environmental justice in the decisions we make, whether that's a decision about prioritizing a product under safer consumer products, or prioritizing which sites to clean up. Site remediation really can be very beneficial. I mean, if we come out the back end of this, one of the things you can do to help the economy recover is do site mitigation. It creates jobs in and of itself, and then you end up with fewer exposures, especially in these communities of color. And so looking for those up, we're actually already having that conversation about how we can come out of this and make sure that that's taken into consideration when we prioritize what site cleanup work we're going to do. We know that 50% of our, almost 50% of our cleanup sites are in environmental justice communities, as indicated by CalEnviroScreen. But at the same time, we don't control everything. We don't control local land use decisions, siting decisions, and it puts us, it's tough. So that means it falls on us to make sure that if these facilities are in environmental justice communities, that we're doing what we have to do to enforce the hazardous waste control laws, make sure they're operating safely, and minimize those exposures that come to those communities. And it's been interesting, even Safer Consumer Products is reflecting on this in a lot of ways and looking for those, they're starting to take on new data mining tools and ways of analyzing which products have impacts. And in doing that, they can then start to find those opportunities to protect communities of color in particular. So, you know, enforcement, engagement, information, all of those things are key to us really providing good protection.
Thank you. So before we go into the Q&A, and I'm actually getting some really good questions coming in on my cell phone. You know, I just want to know from both of you, you know, for our audience's sake, what is one kind of major takeaway that, you know, everyone joining us today, if they could just sort of hold in their minds and then act upon something that each of you would suggest in terms of being able to do our part to protect the health of the greater public? And this is not a planned question, so.
It's actually
it's a think on your toes kind of question.
Yeah, it's a pretty difficult question because I happen to be a pragmatist.
Okay.
So I usually say, do what you can that makes sense to you, and that will help you, but that's not going to help everybody.
Right.
To help everybody more, I think that's going to require more political activity, to bring about elected officials who see the environment as a priority and not a problem. I think too many people focus on regulation as hurting jobs rather than creating jobs. And Meredith just talked about how, you know, cleaning up the environment can actually create jobs. There's been lots of economic analysis done with improvements in our air quality since the first Clean Air Act was enacted in 1970. But the point is, that actually has not only, it saved a huge number of lives, and we don't even usually get an idea about, you know, what would be the cost of the morbidity. We usually just focus on mortality, you know, people dying, but the economics are so in favor of environmental cleanup as opposed to continue to pollute the environment and make people sick. And I think that's something that is a message that somehow has not gotten out there and really not resonated.
So, you know, my big takeaways are really a lot around just the interconnectedness of these environmental issues to everything else that's going on societally. And so, you know, we're able to see, and it's just the visibility that's so striking, right? George Floyd's murder being captured on that 8-minute tape really made it hard. People couldn't look away from the tape, but then they can't now look away from all of the racism that's been around us all the time, but somehow didn't quite seem visible. And in the same way, these health disparities in these communities of color, they're much more visible than they have been. And so I would, you know, that to me is the big opportunity, is to keep making these things visible and keep helping people connect the dots, because people don't associate, you know, environmental protection with the economy or with health. Like Linda said, there's the morbidity and the mortality. And I think now that those things are visible, I'm hopeful that people keep those conversations going, keep those things visible, and make sure they don't fall below the surface again. That's what I'm hopeful for.
It's not a season, it's a paradigm shift completely, kind of to your earlier point. So thank you. So before we go into Q&A, I just want to take a brief pause and thank our speakers for your incredible contribution to science and policy. Meredith and Linda, you're both pillars and incredible drivers of our work at BCPP. We've been so honored to have you with us today. Thank you for making the time. I know you guys are busy presenting all the time, and so we really appreciate your ability to prioritize our audience and our work. And, you know, for nearly 30 years, BCPP has been working to protect you all and all of us from toxic chemicals in our air, our food, our water, and our products, our homes, and our workplaces, linked to breast cancer as well as other diseases. So our work is so crucial at this time, as you know, and so if you have not already, we hope you can make a contribution today. Any size gift matters to sustain our work. We sincerely appreciate it. Again, you can go online or you can find the link in the chat. So now we'll move into our Q&A. I'm gonna just pull up some questions real quick. We have several. Okay, so I'll start from Pat. Her question is, have you looked at military brats, I'm sure she's saying that lovingly, who grew up on toxic military bases and cancer? I'm a military brat who is chemically sensitive. Nanomaterials, GMOs, and petrochemicals all give me inflammatory symptoms quickly and strongly.
So that's, I'll take it first as a research question, and Meredith may talk about if there's any investigations going on in California. frankly, until relatively recently, I think the military has been kind of immune to those kinds of questions. I think the analysis that at Camp Lejeune in North Carolina, the contamination there was associated with an increased risk of cancer, has kind of in some ways led to a paradigm shift. The military is much more sensitive now to the contamination that they have caused on their bases and in the surrounding environments, and is working to clean it up. The cancer studies that have been done that I can think of, almost nothing related to breast cancer, other than Camp Lejeune, where they looked at male breast cancer, which does occur, but it's relatively rare compared to breast cancer in women. But certainly we know that the military has looked at the issue of cancers associated with the atomic bomb testing in their personnel, and there have been studies that have been associated with the Agent Orange exposure in Vietnam, and there are now studies looking at the impacts of the burn pits and other things in the Gulf War and the Iraqi War. So there's some work going on. The military now, especially the VA system, is doing a 1 million person longitudinal study where they're collecting samples from many of their veterans, and we'll be following them for years, which hopefully will allow us to ask certain questions that have been hard to do in the past.
Thank you, Linda. So Meredith?
Well, we're not doing any studies of military sites per se, but I will say that a lot of our cleanup activity around the state is focused on Superfund sites, or that many of which are former military sites, and some active military facilities that have contaminated units within those sites. So the potential for impact there is significant, obviously. And if we look at, for instance, the Safer Consumer Products work on methylene chloride, we know that the Department of Defense has used the methylene chloride to clean landing gear on their planes. And so it was a very big concern to them that if we made that decision to prioritize that product, that it be handled properly and that that specific use be protected. So at the same time, they have been exemplary in terms of their reduction of the use of methylene chloride and their use of closed systems to use the product when they need to. And it really just tells you how influential the military is and how big their footprint is when it comes to environmental issues.
Wonderful. Okay, so I have another question. So if you would both please discuss the role of biomonitoring in your programs and the future of environmental regulation. That's a big one.
I'm going to take this one first because Linda has a lot more to say. Our biomonitoring program is a program that's shared across multiple departments: our Department of Public Health, our Office of Environmental Health Hazard Assessment, and DTSC. And we have never had all the funding we wanted for that program, but it's been remarkable how much work it's been able to do. And, you know, looking, for instance, at PFAS, quite a number of the PFAS chemicals are being biomonitored now in California. And so what's happening with that program is it's looking at different parts of the state every year to monitor in different localities to develop kind of an aggregate picture of chemical exposures in California. And Safer Consumer Products is just one program that will really rely on those data when they become available, and really is hoping to see that program really mature and continue to inform what people are being exposed to, what's getting taken up in their bodies, and what we can act on.
So biomonitoring is really essential for us to understand what exposures are to our population. I could say that it's a little bit after the horse has left the barn, because you find it in people, that means they've already been exposed, and how much better to have avoided exposure to begin with. But California, along with CDC, are probably the two largest biomonitoring programs that we have in our country. The CDC does its biannual report card where they look at over 300 different compounds and approximately 10,000 people each year, every 2 years. The problem is it is cross-sectional, and they don't look at all compounds and all 10,000 people. So if you want to go back in and compare some of the health effects and questionnaire data they have, they may not have the chemicals that you're interested in those people where you have the health information that you want. So that can be a challenge. But I think that the biomonitoring data, first of all, from a population basis, it does allow us, as Meredith said, to address the kind of the trends. What's happening over time with the exposure? Is it going up or is it going down? So for example, dioxins were monitored individually in people in the 90s and much of the 2000s. And then CDC said as the levels went down in these things, especially the dioxins because of the regulatory agenda, it became clear that they didn't have to do individuals anymore, which that's just very, very expensive for dioxins. But in fact, they could look at pooled samples and get the idea not only of what was happening in an age-related fashion and in an ethnicity-related fashion, but also for the population, what was happening by using pooled samples. So that's a way to cut some of the costs and yet still get the information. NIH is increased its biomonitoring, support for biomonitoring efforts. Since NIEHS, we started the CHEER program in 2015, where anybody who had NIH funding for a study and had biospecimens that they had saved from pregnant women or their children was able to request to get that monitoring done. And then that program morphed into what we call the HERE program, where it didn't have to be pregnant women and their children that could have the analyses done. And in addition, environmental samples were being added to the panoply of things that could be monitored. And I think that's going to be very helpful. In many of the programs like the ECHO program, again, you're looking at longitudinal cohorts. And the advantage is with the longitudinal, you can really begin to associate the level of exposure with effects, so you're not all too often, and I will say this especially related to breast cancer, there have been lots of studies done where people will measure, well, what are the contaminants in this person when they're diagnosed with breast cancer? And the answer is, wait a minute, cancer doesn't start overnight. It takes a long time to develop. So unless you're looking at very persistent chemicals that the exposure would have lasted a long time, those chemicals came and they may have gone. I think the other thing to point out is that we're understanding for many cancers, as well as many other health effects, that kind of these seeds for those effects are established sometimes before the baby's even born, sometimes in childhood or in puberty, but you don't see those effects until sometimes 10, 20, 30, 40 years later. So we really have to be careful to look for exposure at the appropriate time related to the effects. And biomonitoring, especially if we save samples, will give us the opportunity to ask some of those questions.
If I could just add one thought, which is biomonitoring is really important. It tells us tremendous things about what people are being exposed to, but it really should be part of a larger ecosystem of monitoring.
Totally.
And I have concerns that we're not doing nearly enough environmental monitoring. What people can find from the sewer shed, wastewater treatment plants and sludge, you can find COVID. It can be a predictor of when these things are starting to show up. And I think that you have to balance the cost effectiveness of different types of monitoring and use these different types of monitoring to complement one another to really get a complete picture of what's going on and what we should be tackling.
Well, and the one other point I totally agree with Meredith is that if we don't know where exposure is coming from, how are we going to ever prevent more exposure?
Yeah. We're not looking for sources nearly enough.
Right.
Great, so it looks like we have time for one more question, and here's a really good one from Zanana. So what do you think about air pollution as one of the contributing factors to COVID-19 infection and recent respiratory hospitalizations in these past few months? So it seems that the areas that were the hardest hit are also the areas that have higher pollution. Any thoughts on this?
Well, okay. I mean, there's the Harvard study, and there are several other studies, including studies coming out of China, which are clearly demonstrating that in areas that historically, and by historically, I'm not talking ancient history, you know, like the last 20 years or so have had, or 30 years have had high air pollution, are areas where we're seeing more problems with COVID. Of course, we should point out is often where do we have air pollution? It's often in our urban areas, sometimes maybe our suburban areas, it's in our more congested areas, it's where more people are living closer together. So then this gets us towards our disadvantaged communities as well. But there's no doubt the wealth of data related to the impacts of air pollution, for example, on not only the adult lung system, but also on the developing child's lungs. We know, and there's great data coming out of California, thank you, Meredith, again, coming out of USC there, showing that, for example, as the air got better from in the 90s to 2000s to like 2010 around LA, in fact, children's lungs were better. They had better lung function, better lung volume, and so on with less air pollution. So I think it all ties together. You know, one partial benefit is level of some kinds of air pollutions were lower, certainly during, say, April when everybody was really shut down. But they're coming back up to where they were. And now that we're in the summer, ozone is as high as it ever was.
I'll just speak from the California perspective, which is to say that just yesterday, the governor announced that 7 counties that had been opening were going to pull back on their opening, close down the bars. And if you look at where those 7 counties are, they are the Central Valley and LA, by and large. And for those of you who aren't aware, the Central Valley of California has some of the worst air quality in the country. And so it's really concerning that these areas would be where the spikes are occurring. So they're going to get hit twice. They're going to get hit by the COVID spike, and we already know they have poor air quality, and which has not been mitigated entirely by the slowdown in the economy. So it really, again, it tells this story of these linkages and how important it is to tackle these things systemically and with the full picture in mind.
So of course in North Carolina, we are also spiking now. Unfortunately, though, our governor, like Governor Newsom, has done a great job of trying to slow the increase, but now we're finding that, especially in some of we have large migrant farmer worker populations, and we're finding a great increase in those in some of the more rural counties as well. But we continue to see increases in for example, our meatpacking plants, as well as obviously the traditional traditional, I'm putting in quotes, areas.
Thank you both. So we are closing in on time, and we have several other incredible questions, wonderful questions, and our team will do our best to get back to you. So thank you all for being so participatory in the discussion. And thank you, Meredith. Thank you, Linda, so much. It's been an incredible conversation. We greatly appreciate your leadership. All that you're doing now and into the future is so deeply felt by our community. Thank you all for tuning into this live discussion. We absolutely could not do this without your support today, and we continue to fight day in and day out to safeguard the protections that we have fought so hard for so many years, to continue to pioneer a path forward and prioritize public health for all people in all communities. So with your support, we can continue to do so. So I encourage you to contribute if you still feel compelled today. So Meredith and Linda, thank you. Have a great rest of your day, and we'll see the rest of you at the next Changemakers Chat coming up in the next month. We look forward to engaging with you in this way ongoing. So take care. Goodbye, everyone. Thank you.